Weight loss surgery abroad or overseas is a hugely riding trend. It is estimated that by the end of the decade, several million patients may choose to have their treatments abroad or overseas, and they fit into four broad categories. Firstly are those where these treatments are inaccessible due to cost, waiting time, or these patients have been refused this treatment. And there are the affluent patients from the developing world who choose to have their treatment in more sophisticated and modern hospitals. There is a small number of health tourism to highly specialized centers which provide world-class treatment that is not easily available elsewhere. And finally, there are the unethical few who offer the impossible treatment options and lure in patients seeking the impossible. In this video, I will highlight a real-life story of Leanne, a name changed, who chose to travel abroad to have weight loss surgery. I will also describe the risks associated with this route, and then finally a checklist for those who are planning to undertake such journeys. Leanne is 42 years old and she has a BMI of 42, which puts her in the severely obese or the morbidly obese. She has an eating disorder, she suffers with depression, and also has type 2 diabetes. She has seen her primary care physician, who has referred her to the local center, but there is a very long wait. Leanne has been speaking to some within her online health self-help group, given her a suggestion to do a web search, a bit like what is shown over here, and then to seek her treatment abroad, get her treatment, and get on with her life. Leanne read some online reviews, most of which were quite positive, then chose a price and a package that was something that she could afford. She had to borrow money from the bank, and she then made contact with the center offering the treatment. They even put her in touch with some of the patients who'd had treatment over there, just so to reassure her. Then traveled overseas, and on arrival she was met by a smartly turned out lady who took her to a well-kept but small treatment center where she met the surgeon. On the day of surgery, unfortunately, the surgeon who was supposed to do her operation had to take emergency leave, and his deputy had to step in. She was reassured that he was very competent and she should not have an issue. Leanne was groggy and sick and slow to recover. However, she was considered well enough to travel back within a few days of her operation. On returning home, she initially felt sick and unwell, and then developed a temperature and was unable to keep anything down within a week of her return. She got admitted to her local hospital. She did not have any notes or any information from the hospital where she was treated. Any attempt at communication was difficult, and there was a language barrier. She underwent the relevant investigation at the local hospital, and she was diagnosed with a leak following a sleeve gastrectomy. The swelling in her leg was diagnosed as a deep vein thrombosis. She was then shifted to a specialist center, and she took over 4 weeks to recover. She was treated with a percutaneously inserted drain to drain the collection, as well as a stent to cover the site of the leak. And while she was recovering, she noticed that her initial reflux, which was not a huge problem before she went for surgery, was now causing her severe heartburn. She was then referred to the local bariatric specialist center, and she's now on a waiting list for revisional surgery. The only issue is that revisional surgery has a high risk attached to it, given her previous history. Let us now examine the risks associated with having surgery abroad or overseas. Firstly, by choosing a surgical procedure from a shopping list, this puts the onus of getting the right or the appropriate operation entirely on the patient. And unfortunately, patients are often not equipped to make that decision for themselves, or to know all the ins and outs of each individual surgical procedure and whether that's appropriate for them. In this instance, performing a sleeve gastrectomy for Leanne was not the appropriate procedure because she had a history of reflux. Then what about information gathering that Leanne underwent? So the online reviews can be problematic because they only offer anecdotal facts. These are specific to that patient and may not contain the entire spectrum of problems that patients can undergo, and there is a possibility of having false reviews. Individual patient contact can be helpful. However, yet again, a positive outcome for one patient does not always translate to the same for the next. Price and package procedures may have issues if they do not contain the full context of the treatment or the surgery on offer, and it must not leave out important aspects of care that could possibly be. Then there are risks related to air travel. So if patients are traveling outside of their borders, they may be exposed to diseases which are prevalent where they are traveling to and may need vaccination. There might be safety or political turmoil issues where they are landing. The accommodation may not be appropriate to their needs, may not provide the appropriate bedding or the bathroom facilities, and so on. They may run out of medication and other supplies needed to keep them going. And finally, there are risks related to air travel itself, especially when the patients are returning. there's a risk of deep vein thrombosis, and often patients are pain and in discomfort, and sometimes they may be refused air travel if they are deemed too sick. These risks are also related to the hospital, whether it's fully equipped with staff and facilities required to undertake such specialist procedures, whether it has all of the subspecialties needed in case things don't go to plan. What about the hospital infection rates, specifically the multiple resistant bugs which are prevalent around the world? What is the hospital's policy around that, and how it is going to prevent the spread of infection from one patient to another, or prevent infection within the patient? Does it have intensive care unit and interventional radiology available when complications arise? What about the surgeon and the surgical team? Is it ethical? Does it have the appropriate training, and whether their outcomes are comparable internationally? The team is quite wide. It includes anesthesia, nursing, physiotherapy, dietitian, IT, radiology, to name but a few. Continuing on with the rest, number 7 is communication related. That is between the treatment center and the hospital or the follow-up that the patient requires. Whose responsibility is it? That is provided in English, which is legible, that there is an open communication channel with the hospital or the treatment center providing treatment overseas, should further information be required. One of the most important aspects of obesity surgery is the follow-up. For instance, patients who have gastric bands fitted, many hospital visits to adjust the gastric band, and this has to be agreed with the team before embarking on this kind of a procedure so that this is ready and available. All bariatric procedures require intense follow-up to detect complications for nutritional reasons, diet and exercise, and finally to detect deficiency of minerals and vitamins, as well as to monitor on weight loss and adjustment of medication for type 2 diabetes, etc. Finally, what about when things don't go to plan? Is there a local specialist cover if things don't go to plan and there are complications from the procedure? What if complication arises during journey? Is the patient going to travel back on a commercial airline? Is that safe to do so? And would the commercial airline actually undertake that journey for the patient? And finally, if the patient returns to their home country, is the healthcare system ready and willing to accept the patient regarding the follow-up, or if there are complications, specifically for patients who have insurance? Would their insurance cover such treatments or complications from such treatments which have not been agreed with insurance companies? And finally, who has the onus of the information that ought to be transmitted between different treatment organizations once the patient has come back? Now let us explore a checklist for patients who are considering treatment abroad. Before you go, it is helpful to have a full healthcare checkup. This includes a specialist checkup for your condition, in this instance obesity, and to assess what treatment options might be available and what are appropriate for any particular patient. Wherever possible, explore local treatment. If there is a waiting time, try and find out how long it is and whether there is any mitigation, such as commencing multimodality treatment whilst waiting for the surgical procedure that might be appropriate for each individual patient. If individuals have decided to go overseas, then it is best to have treatment in accredited hospitals wherever possible. There are several accreditation agencies which are well respected, such as the Joint Commission International, the JCI, the Trent International Accreditation Scheme UK, the International Society for Quality in Healthcare, the International Organization for Standardization, the ISO, obesity related, specifically the International Bariatric Surgical Review Committee. Wherever possible, seek individual hospital outcomes. It is worthwhile to visit the Medical Tourism Association website. This is a not-for-profit organization which offers credible information wherever possible for patients seeking treatment abroad. It is important to find information about the surgeon and the surgical team looking after the patient, their training, affiliation, accreditation, the number of procedures undertaken, the published outcomes where available, or outcomes and complication rates, and finally ethical standards by ensuring that they are not under investigation in the country where they practice. Professionally, surgeons are required to provide this information without any hesitation and as part of the consent process. It is not just important to carry out the procedures safely, but also to the technical standards required of each surgical procedure. The technical standards in bariatric surgery pertain to such issues as the size of the sleeve in a sleeve gastrectomy, that the staple line is secure, or the size of the pouch no more than 30 ml in a Roux-en-Y gastric bypass, and so on. These are hugely important for the eventual successful outcome from the operation, even if the operation is performed safely without complications. Continuing on with the checklist, and after ensuring that the patient is seeking the right procedure for their condition abroad, it is important that the patients fulfill the vaccination requirements, or if there are any prophylactic medication to take, if they are traveling to a tropical country, etc., that they do not have any visa or travel restrictions, and that it is a safe place to travel to. Wherever possible, insurance should be sought for repatriation when things don't go to plan, as well as healthcare information for other healthcare insurance for other conditions. And it is important whose healthcare is provided by insurance in their local area, that these insurance companies are okay with this procedure when the patient comes back and seeks long-term follow-up or, God forbid, treatment of complications. Once patients have arrived at the destination and they have completed all of their due diligence prior to leaving, they should appreciate the risks that I have highlighted above, as well as all of the related mitigation in relation to the hospital surgeon, surgical team, etc. That arrangements are made in hospital stay, how long, their discharge conditions, and where the patients will be discharged to, and initially who will be responsible for the follow-up, etc. All of the discharge medication and for their duration, as well as planning for the air travel back and appreciating its risks such as deep vein thrombosis, as well as others such as treatment of other health-related conditions and the pain and discomfort, nausea, etc. from the procedure itself. One of the most important aspects is the communication. So these communication lines are open, and the details of the treatment provided, specifically the operation, are fully available to the patient upon return, and that this communication line is open with the facility that has provided treatment to the patients. And finally, the risk of complications having been fully explained, the patients understand what treatment is available locally, and what if there is more complex problem, what treatment facilities will be sought elsewhere if there is a complication when the patient is on the way back. Once they arrive locally, who will be responsible for any short or long-term complications, as well as what about the long-term follow-up. All of these issues ought to be established before patients embark on such journeys. This completes this brief overview of this very complex and evolving field. I would welcome comments from patients, and especially those who have undertaken such journeys, and any further comments that they may offer which may help future patients. I hope you found this of use.